All right, 6 o'clock exactly. Looks like we're ready to go. So first, I'd like to welcome everyone to our second YouTube live session. We're going to talk specifically tonight about some health and safety protocol, as well as our specific COVID procedures. So first thing I'd like to do, in the second half of the presentation, we'll also have our athletic department, Mr. Rettinger, Mr. Richards, our district athletic director, district assistant athletic director, here to talk through some athletic updates as well. So we got a pretty full agenda tonight. We'll try to roll through it as much as we can. And again, thank you to the individuals that submitted questions in advance. We had 30 or so questions submitted over the last few days. So we'll do our best to address those tonight. Again, we're not going to go through and answer each question individually, but we have an agenda prepared that we believe will answer the majority of the questions that were presented. So just want to do some quick introductions real quick before we kick off, and I'll pass it off to Dr. Conkle. But joining us tonight are our two district nurses, Shelly Turco and Stephanie Harry, two of our 4 district nurses, which we'll talk about a little bit more as we move forward. We also have Dr. Chad Conkle, our new superintendent, joining us tonight. Becky Tompkins, our director of curriculum and instruction. And right now we have Jason Rettinger, our district assistant athletic director and dean students at Ross Middle School. And then Jake Richards, our district AD, will be joining us here in a few moments. If you know Jake, he's out at a tennis match doing something right now. So he'll be joining us, but we'll cover athletics in the second half of the session tonight. So at this time, I'd like to pass the mic over to Dr. Conkle. He's got a few opening remarks for us.
Thank you, Mr. Castader. Let me first of all say, I know we're in a very uncertain time in our society. I just want to say we will get through this. We have a great staff here at Ross, and we will continue to work diligently to make sure we provide the best educational experiences for our children. I've been on the job for 4 weeks. It's been an honor and a privilege to be the next superintendent. This is a great district, and we will continue to do great things. Again, tonight we're going to talk about the health and safety along with athletics. But I want to briefly talk about the next couple of weeks. Next Wednesday, the 26th, we will discuss transportation and food service, followed by the following Wednesday, which is September 2nd. We'll talk about general guidance and any last minute questions. That leads us into the school year. Just a reminder that Monday, September 7th, we do not have school. That is Labor Day. And then Tuesday and Wednesday, which is September 8th and 9th. Those are students' last names A through K. Will show up on Tuesday and Wednesday. And then Thursday the 10th and Friday the 11th, last names L through Z. And then finally, all students will report on Monday, the 14th. So with that being said, I look forward to the conversation tonight. And again, keep submitting the questions. And we look forward to answering them. So at this point, I'll turn it over to Mr. Castader.
All right, thank you, Dr. Conkle. So what I'm going to do now is I'm going to share my screen, and we're going to redirect everyone to our district website, which we've created a kind of responsible restart section. So a lot of the information that we're going to share tonight, you will see that it's going to be on the responsible restart portion of our district website. We'll try to get there now. Everyone see that? All right, thank you, Dr. Conkle. So what I'm going to do now is I'm going to share my screen, and unfortunately, okay, sorry, it's a few technical difficulties there. I think we're back now to the right spot. Okay, so again, on the district website, we have the responsible restart section, which has a lot of information at this point, the flyers that we initially published detailing some of our restart plan. The tab that I'm on now is our health and clinic guidelines for 2021. And this, I think, will go a long way to answer a lot of the questions that were submitted. And one of the first things we're going to do, an important piece of our plan when it comes to general health and safety and COVID protocol, is the importance of parents, staff members, anyone that's coming into our building on a daily basis, doing a daily health assessment. So at this point, I'll turn it over to Shelly and Stephanie, and they're going to talk through some of those daily health assessments that we're asking people to perform before they send their children to school.
Perfect. Thank you so much, Mr. Castader. So thank you everyone as well for joining us tonight. I'm going to start off before we move to that health assessment. I just want to assure everyone that as nurses in this district, we have spent our summer working diligently, getting ready for this and being ready to have the students back in the classroom. We are very excited to see all of our work come to fruition and see these kids be able to come back and be together and be with their teachers. And we've done a lot to prepare to try to keep it as safe an environment as we can do in the middle of a pandemic. The first thing that we did as a nursing department was decide that we needed help. We needed some help. So Stephanie and I were able to, we have been able to expand the nursing department by 2 additional nurses, which we are very thankful for. So those of you that have been in the district for a while know that there were just 2 of us, and I typically covered secondary schools, the high school and middle school, and then Stephanie Harry typically covered the elementaries. So we've added 2 additional nurses so that each building will be assigned a school nurse, which is going to, I think, go a long way to help keep our students safe and our staff safe, and improve communication with families when we have concerns, and just being able to keep the students here in the classroom. So we've added those 2 additional nurses, and we are, as we have grown our staff, we want this year to feel like a partnership among us as nurses, but we want that to include our families as well. So we are reaching out to you through this and additional communication that's going to be ongoing throughout the year. We need our families and students to really partner with us as we do this in order to keep our buildings open. So the first piece of that is going to be to recognize that things are going to look different. If you haven't heard that before, I'm sure most of you have, that things are going to look different this year, and we recognize that. We know this is not what the practices that we have done in the past. A lot of things are new. So one of the things that we would say that I would just really want our families to hear right now is that it is going to be really important this year for students to stay home if they are sick. And I know that in the past, if you've gotten a call from me, it's not unusual for me to tell a parent, oh, it looks like some cold symptoms, there's no fever, we'll give them something we'll get them hydrated and we'll see how they do, and I'll call you back if things change. And that's not going to be the case this year. This year, we are really imploring you as parents and families, if your child is not feeling well, please go ahead and keep them home from school. And the same once they come to school, if they develop symptoms here, we are going to be reaching out to you and asking you to come and get them so that they can get home and get care that they need and not expose anyone else to any kind of illness. So I know that's different. I know that's, it feels like a lot, but I just want everyone to know up front that this is part of this pandemic plan, is to get children that are not feeling well really need to be home this year in a way that we haven't done in the past. So the first thing we're asking families to do is every day before your child walks out the door, to touch base with your child and talk about it and do an assessment and determine, are they feeling well and are they safe to go to school today? Stephanie is going to run through that with us, but you can see on your screen there, it says daily health assessment checklist. And you will also see in the upper right-hand corner there where it says downloads. Our wonderful tech guru has fixed it so that you can click there and print these out easily. So you might want to print this out and put it on your refrigerator, or if you have a little family area where you all look at each other's information and stay up to date with the calendar, something that you're glancing at every day. That's a great idea too. Then it will just be a visual reminder every day. I need to look at these things and make sure it's appropriate for my child to go to school today. Stephanie, you want to run through that health assessment for us?
Yes, sure. Thank you. Thanks everyone for joining us. We're really happy to have you here. these are some things that we are asking that you do at home prior to coming to any of the Ross buildings. So do you have any of the following symptoms, things that cannot be attributed to another health condition? So if you have any of the following, we're asking that you please stay home until the symptoms are resolved. So things like fever, 100 and higher, or signs of a fever, things like chills, feeling very warm to the touch, flushed appearance or sweating, a new and persistent uncontrolled cough, shortness of breath, difficulty breathing, or if you've had close contact with a person that has a confirmed case of COVID. Now, close contact, that is within 6 feet of an infected person for at least 15 minutes. In addition, please keep your children home if they have 2 or more of these symptoms, things like chills, fatigue, muscle, body aches, headache, sore throat, congestion, runny nose, nausea, diarrhea, and new or sudden loss of taste or smell. We are asking that this health assessment is done at home rather than at the school for a couple of different reasons. First being that the kids will be on buses, so temp checks and things like that will need to be done at home so that we can avoid any possible exposure prior to boarding the buses. Also, we want to avoid crowding, so checking temps at the doors, that will become an area of concern due to crowding and funneling into the buildings. Staff are always needed at their posts first thing in the morning. So secretaries are going to be, answering phone calls and assisting people in the office. Nurses, building nurses, were typically, administering morning medications and providing routine medical care to our kiddos in the buildings. So that teachers are going to be in the rooms assisting kids getting into the room and getting settled. So that is why we're asking parents to partner with us in this screening process. Also, the CDC is not recommending that the screening process take place at school, but rather at home. So it is much easier for you to screen your own children than it is for us to screen entire buildings. Now, with regard to chronic conditions, we do realize that there are students with chronic conditions such as asthma and allergies. So, for example, if your child is having, symptoms of shortness of breath and has asthma, if you give an inhaler and your child is feeling better after the use of medication, that symptom of shortness of breath can be attributed to asthma, and they can attend school. As nurses, we are unable to diagnose. So we may be asking that you work with your healthcare provider to ensure that the symptoms that we're seeing at school are indeed those of the chronic condition and not of COVID-19. So documentation might be helpful, or, it might be requested this year. So that kind of rolls into when to keep a student home. And so I know I just rattled off a whole bunch of symptoms of when to keep your student home, but they're just so important that, it bears repeating. So students that have the following symptoms should stay home from school. And you probably should contact your primary care provider to discuss symptoms. Fever, again, 100 or higher. Sweating, chills, feeling warm to the touch, new persistent uncontrolled cough, shortness of breath, difficulty breathing. And also if you have 2 or more of these symptoms, chills, fatigue, body aches, headache, sore throat, congestion, runny nose, nausea, vomiting, diarrhea, loss of taste and smell, 2 or more of those, they should stay home as well. Contact your physician, discuss things that are going on. And again, all of this is listed for you so that you can reference all of this. Students should stay home from school if they have any of the symptoms that I just mentioned, and have had a known exposure to a positive COVID-19 case. Students should stay home for 14 days if they have had close contact with a person that has a confirmed case of COVID-19. And again, close contact is considered within 6 feet of an infected person for at least 15 minutes. If a household member is symptomatic and or is being tested for COVID-19, students in the home should not attend school until the test result is confirmed. Shelley?
So now that we've gone over what keeps your student out of school, and I know this feels overwhelming. As a parent of children in this district myself, I look at that list and I think, oh my goodness, it's so far reaching, and I understand that. The nurses here are, we are here to work with you and your family. We encourage you to reach out to us with questions and concerns and things that we can do to help. I know the list is exhaustive. But it's the list that the CDC and the Ohio Department of Health have compiled for us. So that is what they are telling us we need to do in order to prevent the spread of COVID-19. So again, you know, if you're faced with something, you are welcome to call us at any time, reach out by email. We will definitely help talk you through the whatever situation you and your family are facing as to whether or not you're not sure about sending your child. Go ahead and keep them home, and then we can talk through this about your next steps. But I do understand that this feels a bit overwhelming because the symptoms are just, there are so many, and they are so, they are common with other illnesses that we see, like the common cold and allergies, and we do understand that. So as the nurses in the district, we want to help you as a family, as a parent. We are more than willing to work with you and talk through this and help you come to the right decisions.
Shelley, I'm going to interject real quick and just talk about a couple things. One is the importance of that health assessment. We were notified yesterday, a school district in Warren County, Lebanon City Schools. I'm going to pull up their Facebook page just as an example of how this can domino and how this spreads so quickly. This is from Lebanon City Schools yesterday. Yesterday was their second day of school. So they made it 2 days and had a student that attended school had symptoms of COVID, and the parents sent them anyway. And again, I get it as a parent, you don't want your child to miss school, but here's what they wrote. 1 student positive test today, 21 quarantine students on the second day of school. So again, more than anything, we're going to talk through a lot of information tonight about how the quarantining process would work in our partnership with the Butler County General Health District to clear up some confusion and misconceptions when it comes to that. But I think the overlying point that we're trying to get across initially, at least, is that it is going to be very, very important that if students are not feeling well and exhibiting these symptoms, they need to stay home from school this year. And as administrators and as teachers and our staff understands, there's going to be increased flexibility this year with students who are missing days, the ability to make up work. We understand that puts people in a bind and it creates a difficult situation, but this can get sideways and out of control really quick if we're not paying attention to the very basic things like keeping kids home when they're not feeling well. So I'll turn it back over to Shelley now, and we'll continue to roll through some of the guidelines.
Perfect. Thank you so much, Mr. Castader. It really is true. We are going to just need to work together and recognize, as we said before, it is going to be different this year. So one question that as we move into when a student is sent home, we're going to talk a little bit about what is going to happen here at school if a student exhibits symptoms at school. One of the questions that came out of our posting was, what is going to happen to my child that has to go to the clinic for a routine visit? Are they going to be exposed to students that are sick there? So what is happening this year is we actually are going to have 2 separate locations to provide care to students who are not, who need assistance from a health professional. So students who are not feeling well, the teachers will do or I should say students that need to see the nurse, the teacher will do a brief screening. They will have some guidance provided from the other nurses and and it will give them these symptoms. The teacher will ask the child why they need to go to the clinic. And if those symptoms fall under the COVID-19 symptoms, they will be directed to the second clinic, the new clinic, the clinic 2.0, if you will. That's where we're going to be this year. And a nurse will meet them at the door. They will then do a more thorough assessment to determine if, in fact, that child needs to is exhibiting symptoms of COVID-19. And again, as nurses, we are not diagnosing. We are not. If you get a phone call from us this year, we are not telling you that your child has COVID-19. That is not in any way going to come from us. But if their symptoms that they are complaining of fall into this category that the CDC, this list the CDC has provided to us, we will have them come in. We will have spacing so that they will not be sitting close to another child. If there is someone there, we will space at greater than 6 feet distance so that they are not, no one exposes another person. And we will make a phone call to a family to get that student picked up. Again, I know it's overwhelming, but we are asking that you please make arrangements, begin thinking what your plan is going to be if we should need you to pick your child up from school, because we want them picked up as quickly as possible. We want to space the students in this room out so that no one exposes others to an illness. I don't want someone in there that we find out the next day they go to the doctor and find out they have strep throat. And then I have to call you and say, while they were sitting there waiting to get picked up, another student was in and that student ended up having COVID-19. So now we've got to have them picked. Now you're in a whole nother situation. So we need to have those, we're going to have the students spaced and then we need them picked up as quickly as possible. When that teacher, so just moving back, the teacher will determine which setting they're going to, the traditional clinic or our new clinic. If they are going to the traditional clinic for things like minor injuries and nosebleeds and routine medication, they will be met there by a staff member who is trained to assist them. And if additional assistance is needed, then they will reach out to the nurse who is in the new clinic, that clinic 2.0, and she can come back after someone is there to monitor the students awaiting pickup. She can come back and assist those students. So we're doing everything we can to keep kids that have routine needs. We don't want them to have put them at any additional risk by exposing them to students who are not feeling well. So we have those two settings. I won't go through again on the screen there. You'll see those symptoms. I know they're listed over and over, but we want people to begin to be very familiar with those. We will assess the students. If they fall into those categories, we will call the parent to have them picked up. And we request that you try to make arrangements to do that as quickly as possible so we can keep that room empty and not have any kind of crowding situation there. So once your student, if you get in a situation where your student is sent home, we, as the staff here, as the nurse here, will let administration know and let transportation know that that student won't be coming back the next day. We need you to, we are requesting that you touch base with a healthcare provider and go over the symptoms. What we may find that your child had a fever and had to go home, and they may see a doctor and find out it was strep throat or an ear infection. And it certainly was not a symptom. The symptom was not attributed to COVID-19. In that case, we would need the healthcare provider to provide a note stating that was an alternative diagnosis and they are cleared to return to school. It may be that your healthcare provider feels that a COVID test is necessary and they want to check. In that case, we would wait for those results to come back in, and then you would again have documentation from the healthcare that you saw from that test that would allow them to return. What we're asking you to do at this point is when you pick your child up and take them home, we can pretty much assume they're not coming back the next day. We need you to, as a parent or as a family, to use that communication with your school nurse and touch base with the school nurse, let them know what's happening. They've been to the doctor, they haven't been yet. How are the symptoms doing? And we will work together to determine when it is safe for your child to return to school. So in most cases, we are recommending that you follow up with your healthcare provider and follow their directions. Again, it is beyond our scope as nurses to be able to give you a diagnosis. But we need to make sure that the symptoms that are being reported cannot be attributed to COVID-19. So we're going to encourage you to follow up with your healthcare provider to get those answers. So we're going to ask that once you've obtained that order to return back, whether it's in the form of a note with a secondary diagnosis, or whether it's in the form of a negative test, or if the symptoms have resolved and your physician is recommending that you return, we are going to ask them that you bring your child into school, let the nurse know that communication is going to be really important. This is what my doctor said, I'm going to bring my child back tomorrow. Bring them in, let the nurse review the documentation, talk with you as a parent and the child, and then we will give them the clearance to return to class. So I know, let me just back up one more time and say it. I know this is different, and I know it's overwhelming. I know it's a lot as a family, but we are trying to do everything we can to keep our students and our staff safe so that we can keep the buildings open. So it is very different, but we feel it is that if we follow the CDC guidelines, we will have the best chance of trying to keep students and staff here present so that we can continue the in-person learning.
Very good. Shelley.
Yeah, go ahead.
Yeah, Shelley, so we're going to transition over now to probably the most common question. I think we're going to run through a couple different scenarios at this point, but the most common question we receive, not only through the Google form, but just in general over the summer is, what happens if my child is exposed, or someone in my child's class, or in the high school and middle school level, one of my children's classes, what's going to happen if someone in their class tests positive for COVID? And I want us to be able to kind of talk through the quarantining process. And I think there's some misinformation out there maybe about who's making those decisions and recommendations. And so I think explaining the partnership we have with the Butler County General Health District. We've been meeting with them twice a week for the last 3 or 4 months, talking through these protocols and procedures. So let's kind of transition to there, and let's give us your answer for my child is in a second grade classroom, and I find out that one of the other students in that class is tested positive for COVID. Where do we go from there, and how does that process play out?
So that is a common question that we are getting a lot. And so let me assure you that as that Ross Local Schools will be working with the Butler County General Health District and following their guidance in this area. The Butler County Health District will be responsible for determining who has to quarantine based on that potential exposure. So it will be their responsibility to determine who has to be quarantined, and then to reach out and notify staff notify families of that situation. At no time will any personal information ever be shared with any parent, any other parent, or any other community member other than what we are required to report to the Butler County General Health District. So no names are going to be shared with anyone through this whole process. We are required to notify the Butler County General Health District and let them know of a positive, if we receive information of a positive case. And then they will begin looking at who fell into those categories that could have been a potential exposure and will need to quarantine. Now they may ask us to partner with them and help with reaching out to you and let you know that you may get a phone call that they are going to be reaching out to you, but it is not Ross Local Schools that will be making the decisions who is quarantining. That will be coming from the health district, from Butler County. They will be responsible for that role. I think we are still, and Mr. Castader, we talked about this morning, we are still working through exactly the exact notification process, how that will work within the district of letting our families know about the cases in the schools. But if your child or a child in that classroom is identified as someone who has a potential exposure, it will be the health department will then reach out and notify the family that they need to begin a quarantine, which is 14 days from the date of the last exposure.
Yeah, and I think that's a good point and clarification to make, is that we're still working through our own internal communication as to how we're going to notify individual classes or school buildings. And I know, I get it, everyone's anxiety is really high about potential cases, and everyone wants to know, if I'm on a second floor of a building and there was a case on the first floor, I still want to know that it was in the building. And like, we understand all of the anxiety and the emotions that are surrounding potential cases in the building. So we're working through that communication process, and we'll be able to share that with you as we get closer to the start of school. But it's really important to remember that regardless of how we feel about the situation, that we are definitely strictly bound to privacy guidelines and HIPAA laws. And I know there's people want and need information in situations like this, but as school officials, we have to be really, really careful about the information that we share with people who aren't directly affected by someone's health condition, or someone that may have had symptoms or a positive case or whatever. So we're going to continue to work through that. We've again partnered with the Butler County General Health District. They're going to help us through that communication process as well. And we'll make sure that as we get closer here in the next couple of weeks to the start of school, that people are well aware of how the communication is going to flow if and when we have a positive case in one of our buildings.
Perfect. So if your child were to be diagnosed with that COVID-19, again, we would be required to let the Butler County General Health District know that a positive case was identified, and then they would guide us through making those decisions as to who they need to quarantine. And again, that would be their call and their decision. But if your child does if a child does have a positive diagnosis, they need to remain home for 10 days from the first day that the symptoms appeared. And then in addition, after those 10 days, as long as they have been fever-free without the use of fever-reducing medications, so that's like without Tylenol or ibuprofen, for a full 24 hours, and they've had improvement of those COVID-19 symptoms, they would be ready to return to school. If by chance a student ended up with a positive test and was asymptomatic, so maybe they had a test because they had a procedure coming up at the hospital, or they had a family member and they were asymptomatic after they had a test, but they weren't having any symptoms, they would need to stay home for 10 days from the date of the test. But again, I would just encourage you, this information is going to remain on the website. Please be familiar with it, look back to it, reference it, and don't hesitate to reach out to the nurses as you develop questions or start to work through this. I'm going to let Stephanie take a couple of minutes. We have just a few things we want to wrap up with as we prepare for the start of the year. Just a few really important health reminders that we hope is going to that we hope will set us up for a great year.
Absolutely. One of those things is it's going to be crucial for emergency forms, medical information, contact information, all of that to be kept up to date all the time, but now more than ever. So final forms, really, it must be updated with current parent and guardian contact information, including emergency contacts, in case the student needs to be sent home for any illness or injury while at school. Immunizations, they are also super important. We do not want to be dealing with an outbreak of another illness on top of a pandemic. So preschoolers and kindergartners will need to have documentation of their immunizations. Just a reminder that 7th graders will need Tdap and meningitis boosters, and 12th graders need a meningitis booster. Immunization records need to be on file at the school by September 22nd to avoid exclusion. That's all.
Yeah, very good. Before we wrap up with kind of the health and safety piece and transition to athletics, I want to address one thing really quick as well, with a lot of talk of quarantine and the potential for kids being out of school with not only a quarantine possibility, but just if, again, we're encouraging you to keep your children home if they're not feeling well. I wanted to ask Becky to talk a little bit about how that's going to work if a student does have to go into a quarantine situation where they're going to miss 14 days of school. It's a lot of time. We understand that. So she's going to talk a little bit about makeup work and flexibility and how we're going to work through those situations to ensure that students don't fall behind and have adequate time to make up any missing assignments when they do come back to school.
Thank you so much, Steve, and good evening, everyone. So a student absence due to self-isolation or quarantine is considered an excused absence. So that means that if a student is absent for that particular point in time, they would have, because of self-isolation or quarantine, they will have that many days in order to make up any missed work. Now, if a student is home because he or she is ill and is sick, absolutely health is the #1 priority when we want our students to take care of themselves. If students are home, however, because of self-isolation or quarantine, then we are going to encourage students and classroom teachers to work together in order to ensure that that student is missing as little classroom content as possible. We're very blessed in Ross to be a fully one-to-one district as far as Chromebooks are concerned, and also have access to learning management systems such as Google Classroom and Schoology. And through those management systems, students will be able to continue to access their daily work and instruction. What we don't, as Mr. Castader alluded to, it would be difficult for a student to miss 10 days of school and then come back after that 10 days and pick up where he or she left off. So we'll be working together as a staff to ensure that students will be able to have access to content, and are encouraging students who are self-isolating or quarantine to stay as current as they can with their daily assignments, so that when they return to school, they're good to go academically.
Very good. So I think you can see if there was one word to describe the most important thing going into this year, I think communication would be it. And we're going to rely on that two-way communication between parents and the school. Again, with adding the 2 additional nurses, we're going to have a dedicated resource in every building. So I would encourage you, if you have any questions at all, that there's not going to be a bad question this year, to be able to reach out and ask those and make sure you're clear with your children's administrators, with their teachers, with the school nurses as we go down this road. Again, we've never been here before. This is new for all of us. So in our community, we work together, and Ross Better Together needs to be more than just a hashtag this year. We need to really live that and exemplify it every day. And I think that'll make the school year and the transition a lot easier for everyone involved. So again, appreciate Stephanie and Shelley being on tonight. We're going to move away from health and safety and COVID talk to athletics. We've got Mr. Rettinger and Mr. Richards, our athletic department, on here this evening, and they're going to give us a couple updates on where athletics are as we stand today.
All right, thank you everybody for joining tonight. The emphasis is on a couple at this point. We are, as I'm sure everybody else has said, we are dealing with a constantly changing situation. So to say that this is a fluid experience is an understatement. So first and foremost, please be patient with us as we navigate. And my phone is blowing up right now, so the governor must have finally come through with the guidelines that were promised at noon. So we will be working through those as quickly and as efficiently as we possibly can to update everybody on some of what's included in that for our contact sports. But let me start by reminding folks of some of the good news. Okay, we've had all of our fall teams have been on campus. Some of our winter teams have been on campus. on a daily basis since we were allowed to restart activity in late May, early June. And I can tell you for a fact that all of our coaching staff and all of our families have taken very seriously the protocol that we've put in place. We've worked a lot of hours with our partners from TriHealth to develop what we think are medically appropriate protocol to make sure that we keep our kids safe. And all of our coaching staff is taking that very seriously. In fact, we've got some sports already underway. So tennis is actually out there on the courts right now, having a great match against Taylor. I believe we were up 3-0 when I left. Our girls and boys golf teams they are about 4 or 5 competitions into the regular season and doing very well. And our soccer and volleyball programs are about to start this weekend, followed by the rest of our sports next week. So that's the great news. We've also got a new digital ticketing platform that's going to allow us to, we like to joke internally, join the 21st century. So you will be able to go onto our rossrams.com, click on box office, and purchase tickets just like you would at Ticketmaster. So you can have your tickets already purchased ahead of time. Don't have to worry about stopping to get cash on the way to the event. Don't have to worry about standing in line at an event. So it's going to be a much safer approach, especially in light of our current situation. The not so great news. So it's no surprise, I think, to most people that we're going to be severely limited in our spectator capacity. Jason's going to talk about that here shortly. Like I said, we just got that news here a couple of minutes ago from the governor. But we've got several different plans in place to try to give everybody access to watch our kids. And that's, our most important things. Number one priority, keep our kids safe while giving them the opportunity to engage in a meaningful sport experience as an extension of the classroom. Number two, to give their family members a chance to watch them live. Okay, and then number three, to give everybody a chance to at least join in via some of our streaming capabilities, our newly developed streaming capabilities. So once again, we are moving head over heels into the 21st century. But like I said before, please be patient with us as we navigate this. It's not easy for anybody. And we are doing our very best to make sure that you are updated in a timely fashion with accurate information so that we can not only have a fall season, but hopefully have a winter season. And my goodness, give those spring kids a season to remember in 2021. So with that, I'll turn it over to Jason to talk about some of what the governor came out with today.
Yeah, so I kind of on my list was talking about spectators at events, and as Mr. Richards was talking, my phone's going off, his phone's going off. We were supposed to get some guidance. We were on 3 hours of calls last night with the governor and lieutenant governor. We were hoping to see something this morning. Then we were given a noon deadline. We did not see it. It is coming out as we talk right now. So we know that you are anxious, you are excited, and probably a little bit even frustrated. We are all of those things as well as we try to figure out how we can watch our athletes play sports. Number one, we're excited that we're going to play sports. So let's just start with that. There is a difference between indoor and outdoor in capacity and what we're going to be able to have. So I was going to talk about how we didn't know what the capacity is, but what I'm reading right now is 15%. So, our stadium fits 17, about 1,700, 1,750. So 15% of that's roughly about 260 people. So we are going to work through what that means. The governor was very adamant that this is immediate family only. But Jake today worked, actually I was watching Periscope Live of our tennis match as we were in here. So we will be streaming our events, from 7 through 12 to make sure that people can watch. But we need to understand that this is going to be very limited in what we're going to be able to do to get people to our contest. And honestly, we just have to do what we can do so that we can continue to play. Like the nurses talked about, so we can continue to go to school. And whether or not we like the rules and we like the protocols, I don't like all the rules and I don't like all the protocols, but I'm going to do whatever it takes so my daughter can go to school at Elda and so that we can get some people to these events. The state has created some roster limits for all of our fall sports, or most of our fall sports. And so our rosters are going to be limited. That is per OHSAA and Governor DeWine. So we will be releasing that. We know when we have a soccer match Friday, Jake and I met right before this meeting talking about protocols set up for that. That is all without this information just came out 5 minutes ago. So we will continue to work on that. If you know anything about Jake and I, you're going to get 15 to 20 emails probably within the next week with everything that's going on. I know Jake puts weekly final forms. It goes out on Sunday nights, which is fantastic, as well as I know this stuff is already on our website, and we could also link it to our COVID site that's on our main page as well. But at any time, if you have questions, just contact one of us. We'll try to work through it. We know we have some concerns with people and getting them into games and stuff, and we will do our very best. But we also need to make sure that we are doing what we need to do. Like as we've been told by the governor, they are even looking at sending people to our stadium and making sure we are doing the right things. So, it's on us to make sure we're following the rules, and we're going to. And I know that's not going to always be the most liked decision, but we're going to do the best we can here. Jake, that kind of gets me through. Oh, and I should mention Friday nights, because we've gotten some questions in the band. The band will be at home events. The band is not traveling to away events. That is not a Ross decision. That is a state decision. And I know that Mr. Raymer was also working on having some events on Friday nights when the football team was away, so that we can still have some activities for all of our groups. So we are very aware of all of our fall groups and athletes and activities, and we are working very hard to make sure everybody's included in everything. So, and I think, Jake, you're going to jump on kind of a question about rules for each sport. And
yeah, back up just a minute here. I was struck when Jason was talking regarding, we are going to do whatever it takes to give our kids opportunities. We know that. Most of the people who are watching this stream, who are our parents, our families, our extended families, will do the exact same thing, whatever it takes. What it's going to take is sometimes doing stuff that we don't necessarily agree with in terms of policy. So for instance, wearing a mask when you come to a Ross sporting event, or a Ross, something at Ross local schools. It's just going to be, that's going to be a rule. And so whatever it takes in this situation, some of it's going to be pretty simple. Wear a mask, stay socially distant. Jason and I, I like to think we're pretty nice and approachable gentlemen. Please don't make us be the mask police or the social distance police at our events. We will have stuff clearly marked. We will have the expectations clearly outlined, and we will do our very, very best to accommodate those people who are most important to our student athletes. And at the end of the day, sometimes we're not going to be able to do that. And that's why we're working so hard to set up these live streaming capabilities. And we will, Jason mentioned we'll have 7th through 12th grade events live streamed. We cannot promise that it's going to be all of them. If you know anything about the world of public education, you know that there is policy that's put in place, and then the resources to enact that policy sometimes, we struggle to make ends meet. We don't have, 27 different people working on live streaming in our athletic department. But what we do have is a committed small group of people, and we will do our level best to stream as many events as possible. The other topic that's come up a lot lately, and some of the issues that we've discussed at length with folks, is it looks like there's a double standard in terms of the sports that we play in the fall and the activities. So I know, band and show choir have been straight getting after it here at the school almost every day. And we've got our various fall sports and some of our winter sports on campus. The rules are going to be inherently different for those sports based on a couple of different factors. So number one, indoor versus outdoor. Our medical partners at TriHealth are great in terms of giving us the advice that we need to be able to create some of the structure for our events and for our teams to safely participate. Indoors, it's going to be much more limited. We're going to have, a smaller crowd, and that's simply because there's lack of airflow. So whatever droplets are out there that potentially carry a virus are not going to be dispersed as well. So there's the lack of airflow, and then there's also the potential for people not to be able to spread out. So you've been in if you've been in our gym, you know that it's a much smaller facility than our stadium, and those are the simple facts. So please understand that's one difference that you'll see in indoor versus outdoor events. There's also the definition that the state has used from the get-go of no contact, low contact, and high contact activities. So early on, I'm a cross-country guy at heart. Not that I don't love every other sport in the world, but cross-country was on the list of contact sports. Now I understand that, in some races you get a little more contact than others, but inherently cross-country doesn't seem like a contact sport. Nobody's colliding into each other to take them down to the ground or whatever. And so what we need to do is kind of adjust our framework here. It's not the fact that these kids are pounding into each other. It's the fact that, let's say at a cross-country event, for instance, the standard cross-country event, you might have 300 kids standing shoulder to shoulder, 7 rows deep from the start line, breathing on each other, screaming at each other, spitting on each other, not intentionally, I'm sure. But that's where the term contact comes into play. Now, I'm glad to report that cross-country was moved into that low contact category. So in no contact are the sports that we actually have going on right now. We've got tennis and golf. Very limited opportunity for contact there. In the low contact category is our volleyball and cross country. Okay, so volleyball, you're obviously touching the ball that the other team's touching, but we have sanitary measures in place to take care of that. And then your high contact sports are football, and I include cheer in that because cheer, as a function of cheer, they participate in football games at this point. So football and cheer and soccer. And so that was what was just released as of yesterday to begin competition this Friday. And so that's where you're going to see some of those differences that come up in terms of protocol. Like I said, and we've said from the get-go, we're going to do our best to accommodate everybody, but also follow the rules that we're given. And we appreciate everybody's patience and grace and your support in helping us do that. In fact, Jason and I get a lot of calls, a lot of emails about these very topics. And some of them aren't real positive. But I will tell you that we've had probably, and I don't know if Jason will agree with this, we've probably had more positive, supportive messages in the last couple of days. A lot of people saying, what can we do? What can we do? How can we help? And I can tell you that the number one thing you can do to help is to wear a mask, socially distance, wash your hands, and encourage those around you, even family members who are adamant that stuff isn't going to change anything. Please encourage them to follow those simple guidelines. And hopefully we all float on okay. And we can all, continue to be eternal optimists.
All right, very good. Jake and Jason, we appreciate it. We know you got a lot of information to dig through here in the next couple hours probably before you can send out updates to our families. So want to just, on a couple of things, I want to share my screen one more time. We've got just a few minutes left here that we'll try to roll through a couple other items that we wanted to share tonight. Again, as we share the screen, I'm going to re-bring up the website, rossrams.com. Under the Responsible Restart headline, there's a drop-down menu there that has all of this information available, including the clinic guidelines. And as Shelley and Stephanie mentioned, you can download those, print them, save them on your desktop, keep them at home. I think that would be good information for everyone to have. One of the other questions that we're still continuing to get is, again, to reinforce the clarification on masks. Masks, neck gaiters, face shields. I'm getting a lot of questions about that. So I wanted to talk about a couple things. One would be, I'm going to try to hold it up in front of the screen here. I can't when I'm sharing my screen, but Cloth masks, disposable medical masks, those are things that we've approved along with neck gaiters, the ones that, wear around the neck, pull up over the nose and mouth. As we sit here today, I know there's been some things that have come out recently that you may have seen that those aren't as effective as masks. The guidance we're still getting from the Butler County Health District is that those are okay, and that there needs to be continued research in order for them to change their mind on those things being effective. So I want to show one other thing that we've just made a decision on here this week in order to, again, provide another layer of protection. I'm going to try to bring up this slide here. We're going to be purchasing desk dividers for all of our buildings, elementary through high school. These are portable dividers that students can place on their desk. That creates a two-sided barrier. Again, we realize that in some of our classrooms, space is at a little more of a premium than others, and so we may not be able to achieve that full social distancing. Again, I go back to Governor DeWine's press conference last week. He had a pediatrician from Cincinnati Children's on who talked about that continuum of safety, and that while 6 feet is ideal and what people should shoot for, 2 feet is better than no feet, 3 feet's better than 2 feet, and 4 feet's better than 3 feet. So the more we can do, the better. And we feel like, again, purchasing something like this gives us another added layer of protection along with the mask and along with distancing. I think we mentioned last week, we have asked our teaching staff to remove what we would call non-essential furniture items from their classroom to create as much floor space as possible that will allow us to stretch tables and desks out to provide the maximum distance that we can within our building. So again, we're continuing to look for ways to be creative and things we can do. And this is just one example of something that we're going to be implementing this year to provide an added layer of protection for our staff and for our students. So at this time, I think that ends our session tonight. I appreciate, again, everyone attending. Appreciate all of our guests for being on here tonight. Shelley, Stephanie, Jake, Jason, Becky, Dr. Conkle. We will be here next Wednesday, again at 6 o'clock. 3 topics we're going to cover. One would be visitors and events into the school. We may ask Jake or Jason to come back on if there's any updates to sports in terms of capacity or the availability of events and things of that nature. And we're also going to have Karen Truesdale, our food service supervisor, on to talk about specific guidelines and things that they're going to be doing in the cafeterias this year. And Peggy Lehman, our transportation supervisor, will be on to talk about how riding the school bus is going to look a little bit different, just like everything else this year, as we, again, get closer and closer to September 8th. Dr. Conkle said it at the beginning. We're really excited talking to our staff and starting to interact more and more with our teachers that are returning. Everyone is really excited to see our kids again. Crazy to think about. We're going on 6 months of not being in school at this point. So I think everyone is ready to get back. And again, we're working really hard every day to try to do that as safely as possible, and we'll continue to do that over the next few weeks until we're ready to be back in school with all of our kids. So again, appreciate everyone coming out tonight and listening. This will be archived on the district YouTube page after this is over. So if you missed any of it, I know there's a lot of information. If you want to go back and rewatch, you can. It will be there for you. And we will see everyone next Wednesday at 6 p.m.